Tuwing July 28 ay ginugunita po ang World Hepatitis Day bilang pagkilala sa kaarawan ng Nobel Prize-winning scientist na si Dr. Baruch Blumberg na nakadiscover ng hepatitis B virus at nakadevelop ng diagnostic test at vaccine para sa nasabing virus.
Pero bukod sa selebrasyon ng birthday ni Dr. Bloomberg, ngayong World Hepatitis Day ay araw ng pagre-raise ng awareness tungkol sa sakit na hepatitis.
Para ipaliwanag sa atin ang iba't ibang klase ng hepatitis from A to E, makakasama po natin ang infectious disease specialist na si Dr. Samantha Punzalan. Hello, Doc. Welcome back.
Hi.
Bati ka muna, Doc, Samantha.
Hello. Good morning, everybody.
Good morning,
Good to
Doc.
be back.
Okay, Doc, can you explain to us in very simple terms kung ano po yung hepatitis?
Okay, so in general, hepatitis is a virus. So it may thrive or mabubuhay siya in different forms, like for hepatitis A and E, nabubuhay siya with contaminated water and contaminated food, while your hepatitis B, C, and D are viruses that live with blood products and secretions ng body, like breastfeeding at saka yung vaginal fluids.
Ano pong organ? Alam ko yung liver, yung primary organ na affected kapag tayo nagko-contract ng HEPA.
So yes, so hepatitis primarily affects your liver or yung atay. So actually yung term na hepatitis kasi talaga is a general term for inflammation ng atay. O liver. Yes.
It's always an inflammation. I always see it, diba? Pero bakit ganun siya ka-contagious at bakit siya ganun kalala?
For the different kinds of hepatitis kasi, particularly yung malalang klase talaga ng hepatitis is your hepatitis B. Kasi maliban sa, it infects your liver cells. So, and eventually, ang hepatitis B kasi can eventually cause liver cirrhosis, which can also cause liver cancer. So, yun yung, kumbaga sa kinds of hepatitis B, siya yung pinakamala. But for your hepatitis A and E, sila yung sinasabing mas common siya in terms of because it's taken from food and from water, but self-supporting siya. So, once yung virus or yung infection ma-resolve, mawawala siya. Or mag-isa siyang magre-resolve mag-isa.
Okay.
So, kaya ng...
It heals on its own?
Yeah, so as long as hindi immunocompromised o mahina ang immune system ng isang pasyente, kaya ng katawan nila na kumbaga matagalan yung infection, so mostly supportive lang. Like, sasabihin nila, kailangan lang ma-hydrate yung pasyente, kailangan kung ano yung losses niya, ma-supplement, tapos matutukan lang na hindi magpo-progress yung pamamaga ng atay. So once na yung virus, matapos na niya yung lifespan niya, mamamatay din siya and then the infection stops. So, mas milder kind sila.
Kasi like, share ko lang na mamapi, kasi my lola from my mother's side, mama ni Mama Dri, she passed, she died from hepatitis, and she was only turning 51 years old. Yeah, it's okay. It's been a long time. Thank you though. But I want to know, saan natin nakukuha yung ganun? Kasi diba it's a virus. Pero
yes.
Is it also genetic? No.
Definitely, it's not genetic. So,
Right.
yung sasabihin nilang, yun, namamana ba siya? So, it doesn't necessarily mean na if your parents have it, you can have it. So, in the case of your grandmother, so, na-mention mo nga kanina sa akin na from Brazil, medyo mataas din ang rates ng hepatitis B.
Correct.
So, hepatitis B, as I mentioned a while ago, is transmitted through blood. Pero mas common din siya that it can be transmitted maternally. So, habang ipinagbubuntis ng isang nanay na may hepatitis B, pwede niyang ipasa yon sa anak niya bago niya, or pwede ding pagkaluwal or nung time na nagpapasuso siya. So, pag yung mga pasyente na nakuha nila yung hepatitis B nila during childbirth or nung yung baby pa sila, sometimes yung manifestation ng disease is on the later stage. So for a very long time, hindi nila,
Parang
wala silang...
dormant.
Kasi
Tapos matitrigger siya?
because of certain, possibly sometimes infection, immunocompromising conditions like diabetes, Or sometimes
That's
yung,
what happened. Kasi she
Yes.
had diabetes pa.
There you go. So,
Yun,
that
doon
could have
lumabas.
probably
See,
triggered
I
it.
found it where, kung saan galing. Kasi kanina, di ba, nag-uusap kami ni Mama Pina, saan mo siya kaya nakuha niyan? Ayan, now I know. Kasi nga, she got diabetes on top of hepatitis. So, malala po talaga. Kasi people can get multiple infections.
Yes.
And then, doon siya magti-trigger.
Yes, so magsa-start siya mag-activate. But unfortunately, hindi naman siya actually agad-agad like detrimental because of the persistent infection niya. Kumbaga, dahil yung matagal na nag-i-infect siya doon sa liver mo. So, nasisira na niya yung atay during those times. But, in terms of, sabi nga, malala ba siya? Kung late stage na siya na-diagnose,
I
yes,
see,
you
I
can have the severe form ng hepatitis B. But, if it's detected earlier, so meron tayong mga preventive measures for patients to not go into yun nga, liver cirrhosis or liver failure.
Yes, I think it's time we talk about the symptoms, no, Doc?
Yes.
Ano ba yung mga simptomas ng hepatitis generally?
Okay, actually, some hepatitis patients will first manifest ng fever, sometimes with fever, abdominal pain, sometimes with nausea and vomiting o pagsusuka. Yung ibang karamihan o mas pangkaraniwang alam ng karamihan na anong simptomas ng hepatitis B is yung naninilaw.
Naninilaw
So,
yung
kapag
whites ng
naninilaw ka na,
eyes, di ba?
hepatitis ka na. Oo. Kasi yung pinoproduce ng atay mo na pigment na nagkakos ng paninilaw ng balat natin at saka yung actually yung una nating makikitang naninilaw is yung puti ng mata natin, yung sclera kasi nga yung pigment niya mako-cover yung eye. So, yun yung una-una nating nakikita. So, for hepatitis A and E, as I've mentioned a while ago, since ano siya, water or foodborne sila na viruses, ang manifestation nila ay gastrointestinal o yun yung pagsusuka, pagsakit ng tiyan, pagdadiarrhea, sometimes yung panghihina. But for hepatitis B, C, and D, actually, dahil bloodborne sila, it can also be sexually transmitted, yun nga, yung maternal to fetal. Sometimes, if it's, yun nga, it is infected habang ipinagbubuntis, minsan wala pang simptomas. Hindi magmamanifest siya ng simptomas. Because nagkaroon ng trigger or yung naging bumagsak yung immune system, yun siya minsan
Doon siya
lumalabas.
lalabas.
So, yung pinaka-common na symptom niya is usually nga, yung paninilaw. Yun yung una-una nilang napapansin. So, kung na-trigger siya ng infection, sometimes may paglagnat, minsan wala pang ang sakit ng tiyan. So, usually naninilaw lang sila.
Loss of appetite.
Meron din, yes.
Pero by then, Doc, pag nanilaw na, does it mean it's in its advanced stages or
Hindi naman necessarily. Ang ibig sabihin lang doon ay mas dumadami yung liver cells mo na nasisira. Kasi yung function ng atay mo, yung paggawa niya ng bilirubin, so yun yung nagkukos ng paninilaw o yung pigment ng paninilaw. So, mas kumukonti na yung liver cells na kaya mag-produce ng pigment na yon. So, mas tumadami na siya sa dugo, so kaya naninilaw yung mga pasyente. But, hindi pa naman siya necessarily yun nga, severe.
Too
Kasi,
late.
like we discussed a while ago, there are also other causes of your hepatitis, not just your viruses. So, it can also be because of drugs. May mga gamot na pwedeng mag-induce ng pag-fail ng atay. Like, heavy alcohol drinking.
Consumption.
Yes. So, kasi, ang alcohol ay pinaprocess sa atay. So, basically, maraming cells ang nasisira or nag-extra trabaho yung atay mo.
May effort kasi sila.
Yes, oo. So,
Mapapagod din sila.
kaya, doon lumalabas yung symptoms ng paninilaw. But as long as, for drugs, as long as itinigil yung nagkakos ng liver inflammation, eventually, pwede ring mawala yung paninilaw.
I'm curious lang,
Yes.
when you see a patient with those symptoms, do you can determine na kung anong hepatitis na meron sila? More or less? Para alam natin ng mga kada na ito, naging yellow na yung mata ko. Parang malala na ba yun? Parang ganon. Paano
So,
ba daw?
sa amin sa mga doktor, definitely, ang pinaka-importante pa rin is a very good history. So, kailangan namin alamin, ano ba yung most likely reason bakit ka nanilaw. So, magtatanong kami ng history ng travel, nag-abroad ka ba, may na-expose ka ba sa bagong pagkain or tubig, or malinis ba yung ininom mong water. So, yun yung para ma-rule out natin yung hepatitis A and E. For Hepa B, ayan, lalo na kapag medyo bata-bata pa o yung mga biglang, wala namang simptomas but biglang nanilaw. So, magtatanong kami, meron ka ba ibang kapamilya? Meron ka bang mga ibang kapatid na baka merong same na symptoms? So, ganon. Tatanong kami, may mga bago ka bang gamot na iniinom? So that we can rule out ano yung mga common na drugs na nagkukos ng liver failure or hepatitis. And gaano kalakas uminom ng alak ang isang tao. So kung talagang heavy, especially mga chronic alcoholic drinkers. So yun, mga possible namin na itatanong. So how do we identify kung viral infection man siya? So definitely, once we've ruled out na hindi siya drug-induced or hindi siya alcoholic-induced, we have blood test, mga serologic test, na we detect the DNA nung specific na virus. So we can identify which particular hepatitis is causing the infection.
Because that will determine also the treatment.
Yes,
Doc.
because iba-iba rin yung gamot
Iba-iba ang
nila.
treatment depende sa...
Anong klase ng hepatitis.
Oo. Doc, ito bang, you said, okay, I know that there's also autoimmune hepatitis and drug-induced hepatitis, pero yung viral, anong virus to? Saan
Viral is
galing?
your hepatitis. Yung hepatitis. Actually, magkakaiba-iba kasi yung from hepa A, B, C, D, E. Iba-ibang klase silang virus. Iba-iba din silang klase ng family. So, may hepad na virus, may galing din siya ng orthomyxovirus, tapos may yung DNA virus. So, iba-iba sila. So, iba-ibang family sila, but they are all viruses.
And are they typically found in like dirty places? Ganun ba yun?
Ayun, particularly ayun nga, yung hepa A and B, they are mostly found in contaminated food or water. Kaya sasabihin nilang, nagka-hepatitis ka kasi kumakain ka dun sa...
Improper ba yung handling?
Food, yes.
Kaya
So,
ba
yun,
ganun?
I think there was a time, even I think nung nasa med school pa ako, na sinasabi nila na yung area doon sa tabi ng school namin, na medyo maraming nagkaroon ng hepatitis kasi hindi proper yung food handling nila. So, meron din actually, magugulat kayo tatanungin, bakit may mga certain trabaho in the food industry that requires hepatitis screening? Kasi there are, yung pag-transmit kasi ng virus can be because of saliva, proper hand washing. Kasi nga, fecal oral siya eh. So, pwedeng baka
hindi nag-hand wash after using the bathroom.
Yes. So, that's why it's important for food handlers to also rule out hepatitis. Kasi nga, pwedeng maging carrier ang isang tao. There's a certain infection that na kakalma siya, pero meron pa rin sa katawan.
Parang you're still a carrier, kahit hindi siya masyadong
So,
lumalabas sa'yo.
So, pag yun nga, ang trabaho nila is on the food industry, they will have to have a clearance na before they start handling food or preparing food, kailangan magti-treat muna sila.
Paano yung transmission, Doc? Kasi there was a time that we were told na kung merong hepa ang isang tao, you cannot use the same things.
The cubiertos, di ba? Mga ganyan.
So, yun yes. For hepatitis A and E, because they are fecal oral, so pwede siyang nasa secretions mo ng saliva, actually, hindi naman sa sipon at saka sa tears, but yun yung pinaka-common. So, hepatitis A and E, yung sabi nilang, yung minimize the use or as much as possible, kung ano ang utensils ng isang tao na may hepatitis.
Huwag
share. Para lang ma-minimize yung matransmit. But for hepatitis B, C, and D, because as I mentioned, blood-borne sila, so hindi sila makakasurvive sa saliva. So, yung transmission niya is different. So, through blood transfusion.
Yes, transmission.
Blood transfusion, sexually transmitted, from maternal to child, at saka breastfeeding. Yun yung modes of transmission.
I have a question lang na wala naman dito sa script. Itong hepatitis, do we have a cure? Yes, we are aware that there's vaccines,
Yes.
right? Pero and then once na-cure ka na, pwede ka ba, well, just tell us kung may cure
Okay.
first.
So first and foremost, prevention is still better than cure. So that's why we promote sa vaccination program natin, hepatitis vaccine. So your Hepa A, we have vaccines for hepatitis A and Hepa B. Ang Hepa C, D, and E, you need to have, ang Hepa C kasi, wala pa siyang vaccine, but it's mostly transmitted kasi through blood, particularly by injecting drug users. Kung yung mga IV drug users. So, yun, ang prevention niya is definitely, huwag kang mag-share ng needle with one person to another.
Or
Yun
just
yung
don't do
worst.
it.
Yeah, don't do that.
That's the best one.
Period.
So, for hepatitis D, you need to have Hepa B first before you get Hepa D. So, kumbaga, kung
very
wala kang
complex.
Hepa B, unlikely kang magkaroon ng hepatitis
So
B.
parang ano siya,
Nag-escalate.
nag-escalate.
Parang kakapit siya with Hepa B. Hindi siya mabubuhay without hepatitis B infection. So for hepatitis E, I think meron na in the works ng vaccine, but currently, kasi hindi siya kasing common ni hepatitis E. So in terms of prevention, it's vaccine. For cure, so once a patient infected na, meron tayong mga medications, but dahil viral infections nga siya, may mga pasyente na pwedeng mawala lang yung symptoms nila, but the virus will,
Still there.
magdodormant siya or
Oo.
matutulog siya, or it will go through a latency period na tahimik lang siya. But yun nga, we have certain medications na pwede siyang completely ma-eradicate, particularly your hepatitis A. For hepatitis B, more of viral control siya. Kasi ibang klase si hepatitis B, it's more of a DNA virus. So, yung treatment niya is mostly for trying to control how much virus a person has. So, as long as we are able to minimize yung viral load niya, kung gaano kadami yung virus niya sa dugo, yun yung ginagawa ng medication. But there could be instances that like infection, biglang decreased immune system, diabetes, pwede na naman siya ulit i-trigger. So, yun yung problem kay hepatitis B. So, once you have, lalo na kung nakuha ng isang tao yung hepatitis niya from childbirth pa lang. So, the risk for you to get chronic hepatitis B is lifetime. So, more of monitoring.
Pero Doc,
prevention.
infectious
Yes.
ba yung taong yan kahit dormant yung Hepa B niya?
Oo, yeah. Meron siyang risk na
Oh,
makahawa.
wow. Kahit hindi niya alam.
So, doon lumalabas yung risk na bakit ang dami nating hepatitis B? Kasi most patients, walang simptomas, hindi nila
Pero
alam.
carrier.
Yes. So, pwedeng dumadami na
Walang
pala yung virus niya. So, that's why pinapaigting actually not just ng government, but yung identification ng hepatitis B
Wait lang.
infection.
Doc, sa mga executive check-up ba, siniscreen yan? Or
Yung
you going to
general,
ask for it
actually,
specifically?
for general, hindi siya kasama. But, actually, pinapaigting na sana magkaroon ng hepatitis B screening for certain age groups. Kasi, like, sa healthcare, importante yun. Kasi nga, blood transmission. Syempre, hindi naman naiiwasan sa healthcare na may matutusok na needle prick.
Yeah.
So, all
More
healthcare
exposed kayo.
workers are required to have
Healthcare
a
workers,
baseline or
okay.
hepatitis B screening.
But as normal?
For normal, ang pinagawa lang siya is mostly for pag nagbubuntis. So, kung part of the prenatal check-up, so, for prevention ng maternal to baby. So, part na ng prenatal workups yun. So, I think the associations of obstetricians already, kailangan kasama siya.
But do you recommend na even if we're not pregnant,
So, for,
magpa-screen
syempre, lalo na
every
kapag,
year?
I think, most sa mga pasyente na nakita ko, especially yung mga hindi namin alam pala na si nanay ay may hepatitis B. So, lahat pala ng anak meron.
Yes.
So, that's the time, we recommend everybody, please get a screening. Basta as long as wala kasi we try to rule in symptoms. Because somebody comes in, Doc, I want a complete general workup. So, we will try to rule out yung mga risk factors na, baka this person needs an hepatitis screening. So, I will definitely add it to my baseline workup.
So, not it's not recommended for everyone to do it. Dapat may medical history.
Dahil una sa lahat, ang hepatitis vaccine is promoted sa childbirth pa lang. Dapat actually pagkapanganak pa lang, kung ipapanganak pa lang, alam na dapat yung nanay hepatitis B ba o hindi. Kasi kung pagkaanak pa lang, meron nang pwedeng ibigay na medication for the baby.
That was my question. Gusto ko itanong.
Yes,
Kasi what if hindi alam, and then dormant, and then had a baby na, pwede ba yung i-vaccine?
Yes, it's recommended that pag na-identify na ang mommy ay may hepatitis B, si baby bibigyan ng hepatitis immunoglobulin. So
Iba
it
naman
will
siya.
try first. So yung na-transfer na ni mommy na virus kay
Opo.
baby, that immunoglobulin will try to neutralize that. And then, kailangan din bigyan si baby ng vaccine. So that's yung regimen for mothers who are hepatitis B positive.
And the baby is now safe for life?
Tapos, they will have to repeat the vaccination to ensure that nakagawa yung baby ng enough antibodies if ever yun for the hepatitis B infection.
Doc, last na. I know that the liver is one of these organs that can regenerate. So, nakaka-recover ba siya from hepa in cases of hepa?
So unfortunately, lalo na kapag hepatitis B, because of the rapid turnover ng virus, and yun nga, yung capacity niya na ma-damage yung liver cells natin to the point na hindi nakakahabol yung restorative capacity ni liver. So that's when makikita yung mga pasyente na in cirrhosis na siya or yun nga, may liver cancer na sila. That's why sometimes kapag yun nga, kailangan na-diagnose ka na ng hepatitis B, we recommend a regular monitoring so as to prevent yung time na mapunta ka na to cirrhosis and as well as yung chance mo na magkaroon ka ng liver cancer. So although ngayon we have modes of yung treatment for liver cancer, which is your liver transplant, but it's a very, although meron ng mga countries na successful na nakakagawa ng liver transplantation, it's a very, in terms ng medical, medyo tedious siya, maraming kailangang screening na gawin. So in terms of financial, not everybody
can
will not
afford
be able
it.
to afford
Kaya,
and
Doc,
maintain.
Kaya, Doc, mabuti pa ay bigyan mo na lang po ng advice kung paano to i-prevent para sa ating mga kada. Let's not go there anymore. As much as possible, i-prevent na lang po natin.
So for all pregnant women, always do not skip your prenatal workups. So kasi yun yung pinaka-primary natin na transmission here dito sa Pilipinas. It's still maternal. And for those na, ayan, sasabihin nila, nakumpleto ko po yung vaccine ko nung bata ako. So, if it is recommended na pagdating at a certain age that kailangan ng vaccination or booster vaccination, please do get your booster vaccinations kasi it will definitely prevent you from getting long-term effects of hepatitis B infection. As for the other hepatitis, yun nga, kailangan we make sure at least we find foods that at least are prepared properly, handled well. Kaya medyo, hindi naman natin, we slightly discourage people from eating. But kung kaya nilang, i-assure that sana yung those people who offer services for food, sana they maintain the cleanliness habit, they always wash their hands. Kasi, quality control yun in terms of, even not just for hepatitis, but for also other infections.
True. Kaya maraming pong salamat, Doc Samantha, for joining us ngayong World Hepatitis Day. For consultation naman sa mga kada nating, saan ka naman pwede mag-contact?
Okay, I'm affiliated with De Los Santos Medical Center, also in San Lazaro Hospital. You can actually see me online on Sirius MD, and I do other online consults.
Thank you, Doc.
Thank you, Doc, as always. At mga kada, ang sakit na hepatitis ay delikado sa kalusugan, lalo na kung hindi agad maagapan.
Kaya bago pa lumala ang hepatitis, magpakonsulta po kayo agad sa doktor para sa agarang gamutan.
Let's take care of our liver to live a healthy and long life.
Let's get together. Sunday 25. Sunday 25.